So good afternoon, everyone. Am I audible?
Good
Yes.
afternoon, ma'am. Yeah.
So welcome to all on behalf of Maharashtra University of Health Sciences, Nashik. I am Dr. Karle Gitanjali, Professor and Head of Ayush. And today we are going to discuss our next dermatological case, which is on scabies. And we have our expert panel and our PG scholar, Pawar. Dr. Shruti Pawar is PG scholar from Dr. Vasantrao Pawar Medical College, Nashik. And she is going to present a case of scabies. And to discuss this case, we have expert panel. Dr. Kamlesh Bagmar sir is here. He is associate professor from Department of Surgery from Motiwala Homeopathic Medical College, Nashik. Then our next expert is from Ayurveda, Dr. Khalid Ambekar. He is professor from Department of Kai Chikitsa from Matoshri Ayurveda College, Parne, Ahilyanagar. Then the next expert is from Modern Medicine, Dermatology, Dr. Bhushan Pelure sir. He is assistant professor from Department of Dermatology uh, and he is from Vasantrao Pawar Medical College, Nashik. So welcome to all. And as we can see here, we have near about 100 and above participants to discuss this case. So welcome to all, and we will start from Dr. Shruti.
Yes,
So,
ma'am.
Yeah, you may
Thank
start.
you so much, ma'am. So today's case is regarding scabies. Am I audible?
Yeah, you are audible.
Okay. Yes. So scabies is a global skin infestation, and just a second. Yeah. So the patient description, today's case, a 22-year-old male who was 56 kg weight, 170 centimeters in height, BMI being 19.38 kg per meter square, with no comorbidities or systemic illness, came with the chief complaints of diffuse intense itching with night aggravation and multiple red elevated lesions over the upper limbs and lower limbs for 4 weeks. And the history of presenting illness was that the patient was apparently all right 4 weeks back when he developed these lesions over both the upper limbs first, followed by both the lower limbs, followed by intense itching, which was insidious in onset and has gradually progressed in nature. There is history of itching which is severe and persistent. To note that it was significantly aggravating at night, that is nocturnal pruritus, and the itching was present over the finger web spaces as well. The history of similar complaints, that is itching and rashes, were there in family members, that is brother and mother, since the past 2 weeks. There's history of pet exposure, dogs at home. There's no history of recent travel. There's no history of topical application, and there is no history of similar complaints in the past. Proceeding to physical examination. So the general examination, the patient is conscious, cooperative, and well oriented to time, place, and person. Vitals were stable, and there is no generalized lymphadenopathy. Cutaneous examination revealed primary lesions of multiple erythematous papules and vesicles with excoriations and the overlying crusting present diffusely over the upper limb, lower limb, and the trunk. The pathognomic lesion was short, linear, thread-like, skin-colored tract, that is scabetic burrows, which are identified in the web spaces of the fingers. This is the pathognomic sign of scabies. Then the characteristic distribution, the lesions were prominently on the volar aspects of the wrist, anterior axillary fold, and buttocks. The face and the scalp were spared. Then the secondary changes, that is signs of secondary infection, were absent. So these are the lesions. As we can see over the dorsum of the hand, there are multiple erythematous papules which we see, and also there are excoriations over the lower limbs because of scratching. So the differential diagnosis can be pruritic dermatosis, which includes atopic dermatitis, contact dermatitis, and insect bite, follicular disorders like folliculitis, and urticaria. Uh, So the investigations that were performed were skin scrapings were taken, which was performed from a burrow identified in the finger web space, and microscopic examination was done under low power of microscope, which showed the presence of the mite, which is Scabies var hominis, and the final diagnosis of scabies was established. Now I would request Dr. Bhushan Telure sir, who is a faculty at Dr. Vasantrao Pawar Medical College, to kindly proceed further with the treatment.
Yeah. Hello. Yeah. Thank you for a nice presentation. I'll just share my screen. Yeah. Is it visible?
Yes, sir.
Yeah. Okay, so as we have established the diagnosis of scabies, so we started the patient on a single dose of ivermectin in the dosage of 12 milligram, which that was given stat. And to control his itching, to achieve remission of itching, we started him on levocetirizine 10 milligram at night for a period of 2 weeks. And we asked him to apply permethrin 5% lotion fortnightly after a gap of 14 days. And permethrin was asked to be applied below the neck or over the entire body with focus on the areas including the genitals, the axillary areas, the wrist areas, and the flexor aspects of the body, including the buttock cleft. And calamine lotion was given after the application of permethrin just to, soothe the skin, irritated skin. So after that the patient was having a good relief.
Yes. Yes, sir. Thank you so much, sir. We will be now proceeding with the discussion regarding scabies, which will cover the general aspects of scabies, the types of scabies. Uh, yes. Yeah. So, discussion. It is a very common public health problem. It is highly contagious ectoparasitic infestation of the skin caused by the human itch mite, as discussed, that is Sarcoptes scabies var hominis. So the risk factors for scabies will be high humidity, low temperatures such as tropical and subtropical countries, overcrowding, poor hygiene and homelessness, and poor nutrition, infested member in the family or sexual partner. It is more in winter and autumn season. And the morphology and the life cycle of this mite, it is a whitish hemispherical mite. The female mite is larger than the male, measuring zero point 0.4 to zero point 0.3 millimeters compared to the male that measures 0.2 to 0.15 millimeters. And it crawls across the skin at the rate of 2.5 centimeters per minute. The life cycle, only fertilized female can burrow into skin. It burrows through the stratum corneum up to the malpighian layer, that is the stratum basalis, at the rate of 0.5 to 5 millimeters per day. So this is the image where we can see the burrows. This is a finger web space, and that is a serpiginous tunnel, as we see in the second image, which is burrow, which is a special lesion of scabies. Now transmission, it is a close person-to-person contact even for 15 to 20 minutes, occasionally via fomites, that is bedding or clothing, when the mite burden is high, as we see in crested scabies, scabies in AIDS patients or immunocompromised host. In adults, scabies is frequently sexually acquired as well. The clinical features, the incubation period being 3 weeks, and in cases of reinfestation, the symptoms develop in 1 to 3 days. There is intense itching, predominantly at night. In the daytime, it is tolerant but persistent itching. In adults, it usually spares the face and the scalp, whereas in infants, it involves the entire skin, including the face and the scalp. Now the signs, there are pruritic papules, pustules, vesicular lesions and excoriations and burrows. Burrows, it is a serpentine thread-like grayish or dark line which is approximately 5 millimeters long, which is found in the stratum corneum, where the stratum corneum is thin. Now this is the sites of predilection which we see in scabies, that is the circle of Hebra. So basically to start with, it will be from the interdigital spaces, then the medial aspect of the wrist, then medial aspect of the forearm, then medial aspect of the arm, followed by axilla, followed by umbilicus and genital areas, and even the gluteal area can be involved. And the clinical types of scabies will be classical, nodular, bullous, the Norwegian scabies, that is crusted scabies, classically seen in immunocompromised host, then scabies incognito, and animal transmitted scabies, which is self-limiting. Now these are the clinical types. Infantile scabies, as we can see, the face is involved, which is usually spared in adults. Then the bullous scabies we can see on the appendix, on coronal sulcus, there are bullous lesions. Then this image shows Norwegian scabies or crusted scabies, where the mite load is very high because of the host being immunocompromised, and nodular scabies. Then this is a secondary infection which we see in scabies. So dorsum of the hand, which shows multiple pustules also. There is crusting also, and serosanguinous discharge can be seen. Then the investigations and diagnosis, skin scraping is taken, which is performed from a burrow identified from the finger web space. As we see in this image, there is the image of a mite, and the second image shows Sibella, which is from the fecal pellets. So it can be identified from the finger web space or from the fecal pellets. Then other investigations will be serological tests, which have less than 50% accuracy. Then quantification of specific IgE antibodies to a major scabies antigen, which is recombinant RSAR-S14. Then PCR can be done, polymerase chain reaction, immunosorbent assays, and dermoscopy. The pointers towards diagnosis of scabies would be the distribution, as we have seen the circle of Hebra, then the morphology, multiple excoriated papules and nodules, then burrows, which are pathognomic, seen in the stratum corneum, nocturnal pruritus, generalized and continuous. There's history of contact with an infected person, or there's history of contact with pets and animals, and when there is response to treatment. The general guidelines for treatment will be treat the patient along with everyone who lives with him. The topicals to be applied over the whole body, below the neck in adults, over clean and dry area, and to be rubbed. In children below 2 years of age, the face, scalp, and axilla should also be included. And avoid touching eyes, nose, mouth with your hands while applying medications. The hands must not be washed after applying medications, as we know that the hands are also involved in scabies. Clothes worn along with the bedsheet, pillow cover, and bed linen should be washed at a temperature of at least 50 degrees and sun-dried in the morning. The itch may persist for a few days after treatment. To review with the physician after 1 week. The topical therapy, the first drug of choice is permethrin 5% lotion or cream. It is most widely used. It is safe even in children as young as 2 months old and pregnant women. Overnight application is necessary. We can repeat the application after 1 week or after 2 weeks. And the mechanism of action of this agent is that it disables the nerve cell sodium transport channel, which leads to paralysis of the mite. Then linden, that is gamma benzene hexachloride 1%. It is effective and safe with proper application. In infants and children, application should be restricted to 2 hours. Repeat application after 1 week. It is a pregnancy category B drug, and the mechanism of action being it acts on the CNS, leading to increased excitability, convulsion, and death of the mite. Benzyl benzoate is available as 25%. Also 12.5% is available, which can be used in children. So it causes irritation to the raw areas and the eyes. So below neck application should be done 3 times within 24 hours without intervening it with bathing. Then crotameton 10%, it is available as a lotion or cream form. It is good antipruritic action. It is applied twice daily for 5 successive nights. It is not approved for use in children and pregnancy, since it is a pregnancy category C drug. Then ivermectin solution, it is in a dose of 0.8% weight by volume. Single overnight application can be done. Repeat application advisable after 5 days. Not safe in children less than 5 years and in old age and pregnancy. Next is precipitated sulfur 5 to 10%. It is relatively safer in infants and pregnant women. 3 consecutive applications are required. Unpleasant odor and cosmetic quality. And it is the oldest anti-scabitic agent that is known. Systemic therapy is mainly ivermectin and systemic antibiotics. Ivermectin is a derivative of macrocyclic lactones. Again, the mechanism is parasite paralysis by blocking the glutamate-gated chloride channel. Safety is not established in children below 15 and pregnant women. The dose is 200 microgram per kg per dose. It is commercially available as 6 mg and 12 mg. Two doses are given 2 weeks apart, and it is neurotoxic to the mite. Systemic antibiotics can be considered when there is secondary pyoderma. Non-irritant and non-toxic antibacterial agents in the topical section can be cetrimide and chlorhexidine. They can be helpful when used topically. Supportive treatment will be antihistaminics for around 2 to 3 weeks, especially at night. Emollients and soothing agents like calamine lotion. Topical or interlesional steroids for persistent nodular lesions, only in cases of nodular scabies, not otherwise recommended. And rarely topical and systemic corticosteroids for allergic manifestations. The prevention and control. Avoid direct skin to skin contact with the infected person. The bedding, clothing used at any time during the 3 days before treatment should be washed and air dried. Rooms should be thoroughly cleaned and vacuum cleaned after use. Environmental disinfection is not necessary. Thank you.
Okay, thank you so much, Dr. Shruti,
Yes,
for
thank you.
wonderful presentation, for detailed presentation about case and overall the investigations, line of treatment, all the
Yes.
aspects of scabies. Thank you so much. And thanks to Dr. Bhushan Telure sir for guiding her and for line of treatment. Then, to discuss this case in the homeopathic approach, we have Dr. Kamlesh Bagmar here. So, I will request. Yeah, welcome, sir.
Yeah, good afternoon, all. It was nice to talk about something, how we can able to understand the same window of a scabies through homeopathy. So let me share my screen. Yeah. Is skin visible?
Yes, sir.
Yeah. Am I audible?
Yes, sir. You are
Yeah.
audible.
Yes. So we are talking about how homeopathy looks it out at the scabies. So it is a holistic healing approach with the scabies, what we have been talking about. So so these are the few cases. Just let me share that recently we went to the taluka place called Surgana, where the children's from the one school, or specifically from the school area, who have been suffering from scabies rampantly. So you can see not only one, two, but the whole school who has been getting affected. Now, how we look it at one patient and how we look it at a community with these kinds of an illness. So I will share my experience with the scabies, what we have been moving through. So as said and done, the scabies, which has been caused by the sacrifice scabies, but does everybody exposed develops the disease? Is a big question. Though we are talking about the contagious, it is one of the high grade contagious disease having an contagion, but there are few exceptions where everyone doesn't suffer even though they have been getting exposed with this disease. And this is a point where the homeopathy tries to consider under the heading that a scabies will be an external manifestation where your immunity, where your kind of a nutritional status, where your kind of the resistance mechanism are being checked. So the mite is considered as a secondary phenomena when we have been talking about a homeopathic point of view. There may be hypersensitivity to the skin or a chronic tendency to the skin diseases. And even the homeopathy has stepped ahead to document in all the research articles where the by giving in local ointments, we can, there are few cases which can land up even into an asthma or neuralgia or some GI troubles, which have been documented. So literally, when as a homeopathy, we have to see scabies with several etiological factors which have been considered, which can be clubbed under predisposing, precipitating, and perpetuating. The predisposing cause in homeopathy, we consider the scabies as the itch, as the key miasm where the patient is suffering with skin disorder, having a lot of itching, and where we are talking about the psoric constitution to it. It may be a predisposed when we are having a poor vitality or a malnourished status. And usually in the schools premises, specifically where the group of children comes together, and if there is a malnourishment added to it, they will develop into into the scabies very commonly. So we are having a precipitating causes like contact with the infected person or mites. That is the commonest cause, what even all the sciences have been agreeing to. But even apart from the precipitation of contact, we can find it out some emotional stress and lower resistance are also triggering factor to precipitate that illness into the specific children or specific age group. Here, I just want to convey that when we went to Surgana and found out all these residential schools, there are lot many emotional stress factors, like they have been away from their parents. They have been away from the love and affections from their motherlyhood. So naturally, all this can become an emotional stressors in the children specifically, where the contact with the loved one has been lost, and it can precipitate into the formation of suffering from scabies if they have been getting exposed to the infected person. And of course, the maintaining causes are very high. When we have been talking about the perpetuating causes, the poor hygiene, the crowding, and the suppression of such a kind of an eruptions become the commonest maintaining factor. So naturally, while treating, we have to consider all these factors in understanding the disease. So this is an interplay of various factors which we consider, where the science considers it as a combination of causes. Now, moving with the diagnostic method as per the homeopathic science, it is not at all different like what modern science which I've been talking about. So the disease diagnosis is specifically from the identification of the parasite, maybe from skin scraping, or maybe from microscopic examination, or maybe from dermoscopic point of view. But here the disease diagnosis is though completed. For a homeopathy to diagnose a person, it is also required to have a closed observation, having a totality of symptoms formation and miasmatic background. Let me go in depth to talk about how homeopathic diagnosis will move with. So person diagnosis will all depend upon the characteristic understanding of the homeopathic principle, location, sensation, modalities, and concomitant. So here the location may be the finger and the burrows between the fingers, the wrist, the axilla, the buttocks, abdomen, as said in children, maybe the face, palm, soles. But what is true to the homeopathy is when in which web of a finger it has been commonly affected, in which side it has been affected, is it right or left side which is predominantly these eruptions are being seen, right? So all, even these small things matters most, so as to give a personal diagnosis, where the, like in this case it has been beautifully stated that it has been moving from the direction from upper limb to lower limb, right? So here we are having the direction of a spread from above downward. That is what it is available in this case. So naturally we are finding a personal diagnosis from the complaints which are available from the point of view of a homeopathy. Now when we talk about a sensation, there may be this intense itching. So the intensity of itching matters, and we are seeing that few patients express their sensation as maybe a burning or crawling or pricking, and we know that these are all due to the hypersensitivity reaction to the mites which have been taking place, maybe due to the eggs or mites which these sensations are been taking place. But the sensation of intensity wise, that can characterize that sensation, and where we can able to have some clue towards the prescription. Now when I talk about in sensation as well as pathology, we are all knowing the pathologies of the burrows, how these mite tunnels and creates the burrows, which may leads to further papules, vesicles, excoriation, and sometimes nodes and crusts. But depending upon this pathogenesis, the choice of a drug selection will differ. As rightly said, that the depending upon this pathology, even the amount of the mites will also differ, right? So accordingly also our choice of medicine will have its impact when we are talking about such a pathology. Moving to the next is modalities, where we believe in aggravating and ameliorating factors. Like few peoples will going to go into a bed and they start scratching and itching violently. So naturally, that warmth of bed, that cold, that heat, washing, these all forms of modifying factors also help to diagnose the patients at a personality level. And of course, the concomitant, where the impact of this itching on specific person. Like in this case, we find out that this 22-year male person who has been having such a kind of a disease, but and the beforehand we are also having that since last 2 weeks brother and mother was also suffering, but this patient is suffering from 4 weeks. So naturally he has started, and from him the disease might have transmitted. But how it is affecting him as a person, with understanding of quality of life, if it has been added, will going to help us in understanding and prescribing for that person. Like one person may going to tell you that because of an intense itching, I cannot able to have a sleep and I am having a lot of irritation because of a itching. That something matters, where at a psychological ground or at a behavioral ground or at a activity ground, how this scabies is affecting that person in terms of management. Now, when we talk about the remedial diagnosis to prescribe, homeopathy as a science, a holistic, which believes on not only on the common features of the disease, but we have been also talking about what may be the individualizing features which are available in the case, like specific location or specific sensation or modality or concomitant. We also understand the disease with the help of onset, after exposure. A child residing simultaneously, one gets very early and one gets maybe after 1 month. So this talks about the propensity of onset and exposure result. So here something where the medical science is been moving, we are moving ahead to understand where is the cause and how the onset and exposure which has been linked can be linked, and what is the duration gap which has been there, so as to decide some drugs which are having a very fast pace, 1 day of just touch and they develop into the disease, and one person who has getting exposed after 10 days, he's been suffering with scabies. So these two peoples will have their different understanding at the level of a remedial level. Then again, the recurrence tendency, we are finding it out that few people, in spite of taking an ivermectin and the leosate or permethrin, they still suffer with recurrence, and these will become a challenge. So now there are few things where a remedial diagnosis, one homeopathically, we can able to think in a different level. So miasmatic background, as I told, Dr. Henneman has used this word miasm. It has been started from the itch itself, the sora, and where we are having a family history or a past history of a skin disorder and propensity to suffer with certain skin problems, they are being getting amount of getting calculated in understanding the remedial understanding. So history of the ointment use, the hygiene and the living condition all matters. So the line of treatment will all depend upon the type of scabies, the level of scabies, is it mild, moderate or severe, is it with or without complication, and accordingly we can decide the drug of choice will be a acute drug, so as to treat intense itching beforehand, so as to treat a chronic phase or chronic or a phase like level. Intercurrent and antimiasmatic can be used in the recurrent cases where the progress is not the level of a relief is not satisfactory, and of course the lifestyle modification itself is important. Just to cite one reference, a research article, so one can have a research perspective also, that and depending upon the number of site, the lesion and the number of eruptions, one can able to classify and grade even the itching from grade 0 to 3, and you can able to demarcate which type of mild or moderate or severe case you have been treating. accordingly, after treatment also, we can able to use the same scale to document the result level. Now, the approaches, like I said, acute stage, our aim and focus will be to relieve the itching, where certain drugs like Merck Sol, Hepar, Sulf, Arsenic Album, and Graphitis are very keen to prescribe for. When we talk about the constitutional correction and the chronic or recurrent action, the sulfur. In Ayurveda, it is in Gandhak. And similarly, in homeopathy, we are having a sulfur as one of the very important remedy, so as to think about the total management of chronic case in a scabies. Whereas calcarea carb, natrum mur, silica, lycopodium are also the added hands to help in chronic recurrent cases. And of course, when the complications are there, we can able to advise, individualize that drug according to the person, along with the hygiene and the maintenance of the care which is required to support the treatment. So, like we are having these types of scabies, rightly said by the presenter, where the might load vary. So naturally, the drug of choice when I am thinking about homeopathically do vary when we are having a classical type sulfur, but when we are having a very thick crust, like here also you will have the crustes on examination has been found out. So the crusted mechanism, if it has been there, and under the thick crust, if the infectivity is also lies, the mesarium will be a very good choice of a drug. Like sepia, soranum. These are soranum is one of the anti-miasmatic and a deep acting drug where you will see the very filthy or the bad smell from the eruption. So overall, there are so many drugs which are having, right, depending upon the commonly indicated drugs. After the thorough research analysis, it has been found that the sulfur, soranum, arsenic album, graphites, mesarium, merxol, these are the few drugs depending upon the individualized symptoms like burning, itching, dry skin. Is it aggravated by warmth or is it ameliorated by cold? So all these are managed according to the symptoms which are present. So the general management wise, we are having, of course, the without general management, we cannot able to come to the proper end of the treatment cure. So like I said, location, sensation, and concomitant wise, we can have the different limit groups of drugs. To talk about the limitations, of course, there is a very good prognosis and you don't find it out any limitations to any science. Hope we are aiming to eradicate the disease completely. So of course, we have to take care about that the relapses should not happen with proper hygiene. And if the complications, if at all there, like it's going into impetigo, cellulitis, then we can have the limitations which are there. So I feel this is what I just want to say. There are few research articles like role of homeopathic treatment in scabies infection in Adivasi children attending ashram shala, a thorough research study which has been documented, and where the for 2 years this the whole aspect of an follow-up has been taken. So these are the various research articles where one can able to find out how homeopathic approach to the management of scabies is there. And I'm immensely thankful and to the organizers for this workshop, specifically the madam, and the working of an Ayush integration, the hope and the vision what Carly madam is having. So definitely this will help us in building up a understanding at a very large level how we can able to move with the interpathy and its understanding of the dermatological disorders. Thank you very much. Thank you all of you for your understanding, giving me a chance to share and to present. And thank you specifically Gitanjali madam to allow me to share my views.
Thank you so much, sir, for detailed presentation. And you have given us a very different view regarding personalized diagnosis according to homeopathy, and it is very important. Thank you so much, sir. And then you have suggested one grading scale. It will be very helpful for our PGs and researcher. So thank you so much. Please stay with us. Sorry to participants. I have some network issues, but I'm conducting from my mobile. So our next expert is from Ayurveda. and he's Dr. Khalid Ambekar. He's professor from Department of Kai Chikitsa from Matoshri Ayurved College, Parner. Ambekar, sir?
Yes, ma'am.
Yeah.
Are you going? I'm going to share my screen.
Okay, sir. Your screen is visible, sir.
Okay. Screen is visible, ma'am.
Yes, sir.
Okay. Thank you, sir. Thank you, Kamlesh, sir, for a very fantastic and very detailed part, homeopathic part you have discussed just. In Ayurveda, if you see, scabies is described as a Pama Kushta. Actually, the concept of skin diseases in Ayurveda is somewhat different from other pathies. All the skin diseases in Ayurveda has been described under the term Kushta, and it is actually broadly divided into two parts, that is Mahakushta and Shudra Kushta. And Pama comes under the Shudra Kushta. It is a subtype of Shudra Kushta. So it is a very important disease. If we see, it is one of the contagious disease we found today. So if you see the etiological factor, it is one of the type of Samsargajanya rog, that is contagious disease, which has been described in Ayurvedic text. So all of you know it is a parasitic disease, and scabies is one of the contagious disease, and skin to skin contact is very important for the spread of this disease. But one factor I want to stress on that is that Viruddhahar. It is one of the different principle of Ayurveda. What is Viruddhahar? For all the non-Ayurvedic participants, I'm going to explore in very easy language. The word Viruddha Ahar, that is the Ahar which is opposite to our immunity, opposite to our body. It is known as Viruddha Ahar. It is one of the very broad concept in Ayurveda. But as far as this meeting is concerned, because we are not having much time to explore all the types of Viruddha Ahar. For example, the Ahar, the food we daily take, if it is going to be anti human body, that ahara is called as the Viruddha. For example, the first type of the Viruddha is called Desh Viruddha Ahara. Today, we will see there are the many types of Desh Viruddha Ahara. Each and every, what we say, the each and every country, each and every state have its specific atmosphere, and according to that atmosphere, all the food items are what would the traditional food items are adapted in that atmosphere. Okay, so in case of Maharashtra, अभी हम देखेंगे कि महाराष्ट्र का जो इन्वायरमेंट रहता है, the environment और साउथ का environment, they are different, that's why their food items are different from each other. वही हम देखेंगे कि चाइना का जो इन्वायरमेंट रहता है, वहाँ का जो बैकग्राउंड रहता है, उसको सूटेबल ऐसे फूड आइटम्स वहाँ के कल्चर में डिपेंड करते बनाए जाते हैं. तो अगर ऐसा आहार जो अपने रीजन में सूटेबल नहीं रहेगा और वो अगर वहाँ पर खाया जाता है, फॉर एग्जाम्पल इफ वी हैव Chinese item or the fast food which is suitable for the Western countries environment, if we take that fast food in our country, it would be one of the type of Viruddhahara. All type of fast foods, all type of Chinese food. और उसी के साथ अगर हम देखेंगे कि महाराष्ट्रियन अगर साउथ इंडियन फूड खाते हैं, तो ऐसी कंडीशन में भी उसको विरुद्धाहार एक बोला जाता है. विरुद्धाहार का कंसेप्ट क्या है आयुर्वेद में, कि हमारा जो इम्यूनिटी रहती है, एज फार एज टुडे we are talking about the scabies, one of the skin diseases. तो इसके अंदर स्किन की जो इम्यूनिटी रहती है, जैसे कि अभी कमलेश सर ने कहा, इन होम्योपैथिक ऑल्सो दिस फैक्टर इज वेरी इंपॉर्टेंट, द इम्यूनिटी ऑफ पर्टिकुलर ऑर्गन is very important to fight the external invasion of the different type of infection. तो ऐसी कंडीशन में जब स्किन की प्रतिकार शक्ति, जिसको हम इम्यूनिटी बोलते हैं, वो कोई भी वजह से कम होती है, तो उसमें सेकेंडरी इन्फेक्शन या बाहर के जो इन्फेक्शन है, पैरासिटिक रहेगा, फंगल रहेगा, माइक्रोबियल रहेगा, वो होने के चांसेस दूसरे पेशेंट से बढ़ जाते हैं। बहुत से ऐसे पेशेंट रहते हैं कि वो पैरासाइट के कांटेक्ट में आके भी उनको वो डिसीज, वो पैथोलॉजी वहाँ पर जनरेट नहीं होती बॉडी के अंदर। तो ऐसी कंडीशन में विरुद्धाहार कंसेप्ट ये बहुत ही इंपॉर्टेंट है आयुर्वेद का, कि अगर विरुद्धाहार पेशेंट लेता है तो ऐसी कंडीशन में इसके भी उसके जो चांसेस बढ़ जाते हैं इन्फेक्शन के, क्योंकि उसकी स्किन वो इन्फेक्शन के लिए सूटेबल हो जाती है। तो इसलिए विरुद्धाहार एक अवॉइड वन ऑफ द मेजर फैक्टर इन द etiology ऑफ स्केबिस। If you see the diagnostic method, it is totally PAMA is diagnosed as per the sign and symptom mentioned in Ayurvedic text or Samhitas. In Ayurvedic Samhitas, if we see, there is a one shlok I want to say here. पिटिकाः पामा कंडु क्लेद रुजा अधिकाः सूक्ष्मा श्याव अरुणाः बाह्य प्राय स्पिक पानी कुरपरे है। अष्टांग हृदय निदान स्थान 14/28। तो ये अष्टांग हृदय ये आयुर्वेद का एक बहुत ही इंपॉर्टेंट संहिता है, उसमें का ये श्लोक है, उसमें उसके साइन एंड सिम्टम बताए गए हैं। तो उसमें क्या बताया गया कि पामा यानी कि स्केबिस के अंदर रेडिश और पेनफुल पीटिका रहते हैं। पीटिका ये संस्कृत में वर्ड है पैप्यूल्स के लिए। तो ये पेनफुल कब रहते हैं, जब उसमें एज सर ने अभी जैसा डिस्क्राइब किया कि whenever there is secondary infection it good all the papules or the majority of the papules turns into the pustules. Okay, तो वही कंडीशन में, in that condition if there is a secondary infection there would be a painful pitika. तो रेडिश या रेडिश ब्लैक कलर के पेनफुल पिटिका स्केबिस में रहते हैं। सिवियर इचिंग रहती है, जैसे कि अभी वो मेडिकल स्टूडेंट ने बोला कि नॉक्चुरल प्रोराइटस, कि इसमें सिवियर नॉक्चुरल प्रोराइटस रहता है, कि बहुत ही ज़्यादा ईचिंग रहती है। इट इज़ सेकेंडरी टू द हाइपर सेंसिटिविटी रिएक्शन टू द माइट। तो ऐसी कंडीशन में ये भी आयुर्वेद में भी यही बोला है कि इसमें सीवियर इचिंग रहती है। थर्ड, इसमें कि लीजन्स आर कॉमनली प्रेजेंट ओवर रिस्ट और हैंड्स, एक्सिलरी रीजन और जेनाइटल रीजन, और स्किन फोल्ड जहाँ पर रहेगा वहाँ पर इसके लीजन हमको ज़्यादातर दिखते हैं। तो ये पामा, ये जो आयुर्वेदिक टेक्स्ट में डिस्क्राइब किया गया है, तो इसमें आयुर्वेद के हिसाब से इसको क्लिनिकली इसके सिम्टम्स के हिसाब से ही इसको डायग्नोस किया जाता है। Line of treatment, all of you know there are the two major line of treatment in Ayurveda for every disease. First is Shodhana Chikitsa, that is Panchakarma, and second is a Shamana Chikitsa. Shodhana Chikitsa means Panchakarma. Pancha means 5 and Karma means procedures. There are the 5 procedures which are used to treat various type of diseases. तो इसके अंदर अगर हम देखेंगे, स्केबिस के अंदर रक्तमोक्षण एक पंचकर्म ये बहुत ही यूजफुल होता है। रक्तमोक्षण मीन्स ब्लड लेटिंग, ये बहुत से यूनानी और आयुर्वेदिक स्टूडेंट्स को पता होगा। तो इससे होता क्या है, जब हम रक्तमोक्षण करते हैं, रक्तमोक्षण कहाँ पर करना है, तो नियर एनी वेन, जो भी प्रोमिनेंट वेन रहेंगी वो लीजन के पास, हैंड की रहेंगी, क्यूबाइटल फोसा में से आप कर सकते हैं, और जहाँ अगर क्यूबाइटल फोसा में की अगर विजिबल नहीं रहेंगी वेन, तो जहाँ पर वो लीजन के पास का अगर एक आधी प्रोमिनेंट वेन अगर होंगी तो उसमें से ब्लड लेटिंग करना चाहिए। ब्लड लेट करने के बाद मैंने जो पहले आपको डिस्क्राइब किया कि विरुद्धार अपने कोई भी डिसीज के वास्ते अगर बॉडी वैसी सूटेबल रहेंगी तो ही सेकेंडरी इन्फेक्शन उसमें हो सकता है। तो जब हम ब्लड लेटिंग करते हैं तो वहाँ का जो वो डिसीज को जो पैथोलॉजी के अंदर जो इम्पोर्टेंट जो फैक्टर रहते हैं वो बहुत से वहाँ पे कम हो जाते हैं, उसी को आयुर्वेद में दोष कहा है। तो रक्तमोक्षण के बाद वहाँ के जो लोकल जो दोष है वो निकल जाते हैं, और उसकी वजह से वो डिसीज का बहुत सा जो स्ट्रेंथ होती है वो कम हो जाती है। उसके बाद वमन मीन इसमें क्या करते हैं, वोमिट किया जाता है, ये भी एक अलग टाइप का पंचकर्म है। ये कफ दोष प्रधान व्याधि के लिए किया जाता है। हेयर इज नॉट मच टाइम टू एक्सप्लोर ऑल दिस थिंग्स, सो आई एम शॉर्टली एक्सप्लेनिंग हियर। और दूसरा है कि विरेचन, इसमें लूज मोशन दिए जाते हैं पेशेंट को, वो भी एक अलग कंसेप्ट है। उसके जरिए भी दोष मीन्स क्या है कि वो जो डिसीज की जो पैथोलॉजी है, वो पैथोलॉजी के बहुत सी चीज़ें उसमें इन्वॉल्व होती है, उसको वो हैम्पर करना या उसको वहीं पे ब्रेक करने के हिसाब से ये पंचकर्म का रोल होता है। दूसरा आता है शमन चिकित्सा। शमन चिकित्सा मीन्स इसके अंदर दो चीज़ें हैं। एक तरफ बाह्य चिकित्सा, दैट इज द एक्सटर्नल एप्लीकेशन और टॉपिकल ट्रीटमेंट ऑफ स्केबिस, और सेकंड है अभ्यंतर और इंटरनल मेडिसिन, जो भी हम ओरल मेडिसिन देते हैं। बाह्य मेडिसिन का ये जो प्रिंसिपल आयुर्वेद में स्केबिस के बारे में ऐसा है कि इसमें तिक्त कषाय रसात्मक द्रव्य का यूज होता है। व्हाट इज द मीनिंग ऑफ तिक्त कषाय रसात्मक? तिक्त मीन बिटर टेस्ट एंड कषाय मीन स्ट्रिंजेंट टेस्ट। ये जो जो ड्रग्स के होते हैं, ये आयुर्वेद का अलग कंसेप्ट है, क्योंकि इसको ज्यादा डिटेल में नहीं बता सकता। फॉर एग्जाम्पल जो कि कड़वे कड़वे होते हैं, जो कड़ू रसात्मक होते हैं, ऐसी कंडीशन में फॉर एग्जाम्पल चंदन, ऑल मस्ट हैव हर्ड अबाउट चंदन, उशीर, मुक्का, सारिवा, किरात तिक्त, तुलसी, a very familiar one of the antibacterial drug or anti-parasitic drug, Harad, Daru Harad, Trifra, all these medicines are used for the external application in case of scabies. The second part is internal medicine. In case of internal medicine, also Tikta Kashaya Rasatmak drugs, all these drugs which just I have explained you, all these drugs are also internally used in वेरियस फॉर्म्स। वेरियस फॉर्म्स का मतलब क्या है कि एक तो टैबलेट फॉर्म में आते हैं, इनके एक्सट्रैक्ट फॉर्म में आप यूज़ कर सकते हैं, या दूसरा ऐसा है कि इनके काढ़ों की तरह के इसका काढ़ा बना के भी आप यूज़ करते हैं। सौरस मीन्स अगर नींब पत्र, फॉर एग्जांपल नींब पत्र आप ले रहे हैं, तो लीव्स जो रहते हैं नीम के, उसको कूट कर उसका जो रस निकलता है, वो भी एक्सटर्नल एप्लीकेशन या इंटरनल लेने के लिए भी उसका यूज़ किया जाता है। तो वेरियस फॉर्म के अंदर इंटरनल मेडिसिन आप यूज कर सकते हैं। दूसरा आता है इंटरनल मेडिसिन में, जैसा कि अभी सर ने डिस्क्राइब किया होम्योपैथी के मेडिसिन पार्ट के अंदर, कि सल्फर इज वन ऑफ द वेरी इंपॉर्टेंट ड्रग विच इज यूज्ड इन स्किन डिसीजेस इन आयुर्वेदा। तो ऐसी कंडीशन में गंधक है, गंधक के जो कल्प रहते हैं, आरोग्यवर्धिनी गंधक रसायन है, उसी के तरह से पंचनिम्ब घन है, बाकुची घन है, ये अलग अलग टाइप के मेडिसिन ये आयुर्वेद के अंदर उसका यूज होता है। तो इस तरह से हम देखेंगे तो आयुर्वेद में लाइन ऑफ ट्रीटमेंट ये स्केबिस की होती है। व्हाट आर द लिमिटेशन while treating the scabies? Actually, in Ayurveda, any lesion which is older than 1 year is described as any lesion which is older than 1 year has very poor prognosis. तो ऐसी कंडीशन में उसका प्रोग्नोसिस बहुत पुअर हो जाता है। वेरी सीवियर साइन एंड सिम्टम्स, इफ एनी पेशेंट इज हैविंग वेरी सीवियर इचिंग और वेरी large, very elevated, what we say, papules, or is there any secondary infection, if there are many pustules, and in that condition also the prognosis is very poor. Third is if the large area of body is affected, if the whole hand is affected, all the genital areas affected, axillary, both the axillary areas affected, and if the affected area is large, that is also having a very poor prognosis. So this was the Ayurvedic part we just I have discussed here, because I am having not having much time to describe in detail. So a very short part of scabies I have discussed here. So here, thank you for listening me, and thank you, Carle Madam, for giving me an opportunity to present my part. Thank you.
Thank you so much, sir, for your presentation. And as sir told us that the main culprit is Viruddha Ahar. According to Ayurveda, Viruddha Ahar means his simple definition is opposite to our body. And thank you so much, sir. So due to Viruddha Ahar, our immunity hampers, and then Krimi is one of the terminology in Ayurveda, which is explained in our text also. So there is certain difference in three pathies. So according to modern medicine, mites are there. According to Ayurveda, krimis are there. According to homeopath, mites are there. But according to homeopath, mites are secondary. Hypersensitivity and another issues, immunity and the other personal issues told by Bagmar sir are more important according to homeopath. So there are certain differences and there are certain similarities in all three modalities of treatment. So now this forum is open for question and answer. Our three experts are here. Is there any question from participants? You may write or you may unmute and directly talk with us. So one question is from my side. How to differentially diagnose this scabies from herpes zoster or the other certain infections, which is also having some papules and all. Dr. Bhushan sir?
Yes, ma'am. So, actually, scabies will not have if scabies is presenting in a linear fashion, then only we will consider herpes zoster as a differential, because herpes zoster will involve one particular dermatomal site of involvement. And maybe in the beginning, yes, you can suspect that scabies and herpes zoster might have similarities, because herpes zoster can start as papules also. But generally, over a period of 2 to 3 days, the zoster will flare up into a bigger vesicles and involve only that particular area. And itching is not a main complaint. There might be itching in some patients, but itching is not usually a main complaint. The patient might have other symptoms such as burning sensation or pain, or the patient might have a prodromal symptoms of fever. So these are present in the herpes zoster, but for in scabies, the main presenting symptom is nocturnal itching itself. And as described by Dr. Shruti, it is usually present in the flexural areas. And rarely it might develop into a vesicular manifestation, but it is not dermatomal. Herpes zoster disseminatus or maybe herpes eczematicum might be a differential diagnosis to scabies. But again, in those patients, the clinical features which are there are different. For example, in herpetic eczema, that is herpes eczematicum, the patient will have his high-grade fever is there, and disorientation is there. The general condition is usually poor. So mainly it is the symptoms and the clinical presentations which are there that help differentiate between scabies and the other parts. A close differential diagnosis to scabies is actually atopic dermatitis. That will become a difficult thing to differentiate if the patient is not having typical signs of scabies. And scabies in clean is one terminology which is sometimes present in patients. That becomes difficult to diagnose and differentiate between atopic dermatitis.
Okay, sir. Thank you so much. Then other questions from our participants? So next question is for Ayurveda and homeopath. What are the limitations to treat such kind of cases? Actually, Khalid Ambekar sir had already told us that there are three limitations like large area and but I would like to ask this question to Bagmar sir. What are the limitations according to homeopath to treat such kind of cases?
the same like what Ambekar sir has told really even applies to this science also modern. Until and unless the surface area, total surface area of a body, if it has been extensive and if the infectivity has been large there, so naturally all these are the complicated cases where we can think of. So to handle these complicated cases, we may have to have a close look how we have been subsiding that whole infectivity, because to manage scabies is one aspect, and to manage the infectivity and the complications related with it will be the another aspect. So at such a level, if the surface area has been very extensive, and if the patient has been having any complications, maybe in a very rare cases we can find out chronic glomerulonephritis which can set up because of an infectivity. So all such a diagnosis where we are having a limitation. Rather than limitation, we can have a separate modality so as to treat all these complicated cases.
Okay, sir.
Yes.
Thank you so much. So now we can stop here. Thank you so much, Dr. Shruti, for excellent case presentation. Then Dr. Kamlesh, sir, thank you so much, sir, for your homeopathic approach toward the scabies. Then Dr. Khalid, sir, and Dr. Bhushan, sir, thank you so much. Thanks to all participants. Please be with us for the next case. Till then, bye-bye.
Thank you.
Thank you.
Thank you,
Thank
ma'am.
you, ma'am. Thank you.
Thank you, ma'am.
आईडी है पासवर्ड मीटिंग ये लोग अभी नहीं
Hello,